Very often when you're going through the prostate cancer pathway, at some point someone will make a reference to the MDT. That's the multidisciplinary team. Really what they're referring to is a meeting where your case is presented. You won't be present, it'll just be the doctors and the nurses and all the specialists involved. And we'll talk about the factual information about your case. And that basically means we'll look at the PSA, we'll look at the scan, we'll look at the biopsies, we'll look at any staging scans that you've had. And at the end, we'll be trying to describe your case in terms of its grade and stage and what treatment options we think are suitable for you. This is a meeting which is held very quickly, so your case might only occupy 2 minutes of everyone's time. And it doesn't, of course, necessarily take into account, your presence in the decision-making process. So you're not really in the room. And it can sometimes, be problematic because if you've got a sort of set of past medical history issues or preferences that may have been written down in a document but didn't come to light during the meeting, very important things can be missed. So it's important when considering these MDT outcomes to realize that they have their limitations, and it doesn't mean that you're consigned only to those things. And if after the MDT you're talking with your doctor, it's quite sensible for the MDT outcome to be questioned and queried, and you might even want to take it back to the meeting with more information, particularly if scans haven't been completed or important bits of past medical history or lifestyle preference have not been conveyed to the meeting. Most frequently, we will come across issues where an MDT outcome might say, patient suitable for radiotherapy, and no discussion about alternatives. These men, if they're suitable for radiotherapy, could quite conceivably be suitable for surgery as well. But if someone's just looked at how old they are and written them off, that might be an unfair decision of that MDT. Particularly if that MDT it didn't have a surgeon there who was comfortable operating on men in their late 70s, for example, or overweight men. And most MDTs don't have somebody who performs focal therapy. And so it's very common for the MDT to overlook the suitability of men for focal therapy. So I think it's very important, particularly if you've only got disease on one side or just in the front of the prostate. If focal therapy hasn't been mentioned as a potential option, you might want to get your case discussed by a focal therapy expert so we can assess your suitability, discuss your case in our focal therapy MDT, and really work out if that's an option for you. So the MDT has its strengths and weaknesses. It's really there to try and make sure everyone's case is discussed by cancer experts. But nowadays, with cancer really only being looked after by cancer experts, you have to kind of take the MDT outcome with a pinch of salt sometimes, especially if it hasn't, if all the options haven't been considered. If you've recently been diagnosed with prostate cancer or you're exploring your treatment options, we're here to help. At the Focal Therapy Clinic, we'll talk to you through your diagnosis, explain whether focal therapy may be suitable for you, and help you to make an informed decision about your treatment. You can learn more or arrange a consultation by visiting the Focal Therapy Clinic.